All right, welcome everyone. Ready for another deep dive. Today we're tackling the world of pharmaceuticals.
No stethoscopes required.
Nope, but we do have an awesome source. Dr. Khaled Hasan put together this presentation on the top 200 drugs.
200, that's a lot.
It is, so we're breaking it down. Today, it's all about the B's and C's.
Because even if we aren't doctors, knowing about common meds, that's powerful stuff.
Totally. Helps you talk to your doctor better, understand your own prescriptions, even just decode those crazy TV ads. You know what I mean?
Oh, absolutely.
Okay, let's jump in. The B's. And I think we've got to start with something most of us have dealt with. Muscle spasms.
Oh, for sure.
Baclofen's the hero there, right?
Hmm?
A muscle relaxant. Eases those aches and pains.
It does, but then you got Bevacizumab. Now that's a whole different game. That one's fighting cancer, colon, lung, breast, you name it.
Wow, it's incredible how targeted cancer treatments have become.
It really is.
And speaking of targeted, there's Benztropine for Parkinson's. I always think of Michael J. Fox. His work raising awareness has been amazing.
Oh, absolutely. Public figures can really shine the light on these conditions.
For sure. And while we're on the topic of keeping things running smoothly, there's Bisoprolol, a real workhorse for heart issues.
Oh, yeah. This is a big one. It's a beta blocker. Blocks certain receptors in your heart, helps lower blood pressure, regulate your heart rhythm. I bet you someone listening right now is on a beta blocker.
You're probably right. It's kind of wild to think about.
Yeah.
Okay, next up, Buprenorphine and Naloxone. That combo's on the front lines of the opioid crisis.
Addiction treatment is so complex, but this medication is a huge step forward in helping people get on that road to recovery.
Definitely. And let's end our B's on, well, a slightly less intense note. Who hasn't had a tension headache that just wouldn't quit?
The worst.
But Albutal to the rescue. You might know it as part of Fioricet, that pain reliever.
And that actually brings us right to our C's. Because Fioricet, it's got another ingredient you'll recognize. Caffeine.
Wait, really? I mean, I know it's in there, but I never thought of caffeine as like a drug.
Oh, it is, technically speaking. It's a stimulant, acts on your central nervous system. That's why it's often added to pain relievers like Fioricet. Gives it that extra boost.
Makes sense. Okay, well, let's keep going. This time, a complete shift. Canagliflozin, newer medication for type 2 diabetes.
Right.
It's an SGLT2 inhibitor, I think.
You got it. I know, it's a mouthful. Basically, it helps your kidneys get rid of extra sugar through your pee.
Through your pee.
Yep. So it can actually lower blood sugar levels on its own, even without insulin. Pretty big deal in diabetes management these days.
Okay, fascinating. Now, back to Parkinson's for a second. We have Carbidopa. It also treats the disease, but differently than Benztropine.
Yeah, this is a perfect example of how there can be multiple ways to treat a single condition. Carbidopa boosts dopamine in the brain. That's a key neurotransmitter, and it's lacking in people with Parkinson's.
So it's like having different tools in your toolbox. You wouldn't use a hammer when you need a screwdriver.
Exactly. And speaking of tools, Carvedilol, another beta blocker like Bisoprolol. So folks, do you know your blood pressure meds? This stuff matters.
It really does. Now let's move on to infections. Time for the cephalosporins. Cefdinir, Cefuroxime, and Cephalexin. They're all slightly different, but they're all about fighting bacteria.
All antibiotics,
Yeah.
really important, but antibiotic resistance, it's a growing problem, so we got to use these responsibly. Doctor's orders only, people.
Right. Now let's talk pain and inflammation. We've got Celecoxib. It's a COX inhibitor.
Which I know sounds like a bunch of letters.
It does.
But what it means is it targets certain enzymes involved in inflammation, so fewer side effects, especially compared to some other NSAIDs.
So if you need long-term pain relief.
This could be a better option.
Gotcha. And before you even need the pain meds, Chlorhexidine. All about prevention. Cleaning the skin before surgery, getting an injection, that sort of thing.
Gotta love a good preventative measure.
Absolutely. All right, ready for a rapid-fire round for the rest of our C's?
Hit me.
Chlorpheniramine, your classic allergy medication. Then we've got Ciprofloxacin, or as most people know it, Cipro, a broad-spectrum antibiotic.
And with those broad-spectrum antibiotics, there's always the risk of overuse, which, you guessed it, can lead to antibiotic resistance. It's a tough balance using them enough to treat infections, but not so much that they stop working in the future.
Makes sense. Next up, Citalopram, a common SSRI, a selective serotonin reuptake inhibitor.
Depression, anxiety. It's a reminder that mental health is just as important as physical health.
100%. And then there's Clarithromycin. Now, this one's interesting. It treats both ulcers and infections.
Right. Shows you how connected everything in the body really is.
It's incredible how complex it all is. Clindamycin, another infection fighter, but with different uses than the others we've talked about.
Doctors have to think carefully about which one's best for this specific situation.
So many choices. Okay, how about this? Clonazepam for seizures, but also for anxiety. Again, the brain is just
Wild, right?
totally wild. Right. Something a little more relatable. Clotrimazole. I bet a lot of people have used this without even knowing it. Athlete's foot, anyone.
It does that, plus other fungal infections.
Okay, moving on. Clozapine. Now, this is for serious mental illnesses like schizophrenia. A powerful medication for when you really need it.
Yeah.
And if you've ever experienced gout,
Oof, painful.
you know it. Colchicine stops it in its tracks.
It does. And last but not least, we have Cyclosporin. This one's crucial for organ transplants. Helps prevent your body from rejecting the new organ.
Wow. It's incredible to think that we've only covered drugs that start with B and C. There's a whole alphabet of medications out there.
And we've only just scratched the surface.
It's amazing to see the range, though. From everyday aches and pains to life-saving treatments. It's really impressive.
Each one has its own story, its own way of interacting with the body.
And as we learn more about the human body, we're only going to discover more amazing connections and uses for these drugs. It's really exciting. But stay tuned, because we're not done yet. There's still so much more to uncover about the world of pharmaceuticals.
So much. I mean, it makes you think, right? Each drug, it's like its own little story, how it works in the body, what it does.
It's wild. Like with Clarithromycin, the one we talked about, ulcers, A and D infections. Who knew those two were even related?
Right. And that just shows you we're always learning new stuff about the body. Connections that we never would thought of before, suddenly they're right there.
So basically, the more we learn, the more we'll find even more uses for these drugs, probably.
Oh, absolutely. That's what makes this whole field so fascinating. It never stops. So, okay, big picture for a sec. What do you think our listeners should really take away from all this medication talk?
Well, I think the biggest thing is knowledge is power, right? The more you know about how these drugs work, the better you can talk to your doctor, understand your own health, make good decisions about your treatment.
It's not about self-diagnosing, of course.
No, definitely not. But it's about being an active part of your own health care.
Exactly. And another thing, there's rarely just one right answer when it comes to meds. Think about Parkinson's, right? We talked about two different drugs, both for the same disease, but they work totally differently.
Yeah, like having different tools in your toolbox.
Yeah.
Pick the right one for the job.
Exactly. That's where personalized medicine comes in. Finding the treatment that's best for you, not just some general guideline.
It's pretty amazing how far we've come with that. So as we move on from our B's and C's, anything else you want to leave our listeners with about these drugs, I mean?
I guess the big thing is every medication, it has potential benefits, but also potential risks. It's a balancing act. And that's why you got to talk to a doctor.
Right. Weigh the pros and cons, make an informed decision.
Exactly. And, let's not forget all the work that goes into these medications, the research, the development. It's pretty incredible what we've achieved.
Oh, totally. From the scientists who discover new stuff to the people who test it, the doctors who prescribe it, it's a whole team effort.
And the patients who participate in the trials, too. Can't forget about them. They're putting their trust in science, helping us learn more.
Absolutely. It's really inspiring when you think about it. So, okay, as we wrap up our B's and C's, what other areas of this whole drug world do you think we should explore next?
Oh, man, there's so much. I'm kind of fascinated by the history of all this. How did these drugs come to be? How have they changed things?
Yeah, Like imagine tracing the whole life of a drug, from when it was first discovered to how it's used today.
Exactly. Or what about the future of pharmaceuticals? All the new tech, the breakthroughs.
Think about it. Personalized gene therapy, treating diseases at their root. So stay curious, keep learning, and until next time, stay healthy. Thanks for joining us on this deep dive into the fascinating world of pharmaceuticals. We'll see you next time.